us for the STAR training today at the Center for Autism and Related Disorders. Today we have a training that's going to be led by our wonderful occupational therapists right at our own center. So they're going to talk a little bit more about what they're going to tell you about. Please turn off your cell phones and complete the surveys and give them to me at the end.
My name is Megan Owens. I'm an occupational therapist here at CARD, and these are the rest of my colleagues. This is Janine Lindenstrup, Marisa Anderson, and Megan Hinderer. That's our whole department. So we're happy to have you guys. Can you guys just kind of tell us who you are so we can gear this presentation towards you? Do we have any parents? Okay. Occupational therapists? Other providers? Anybody else? Teacher?
I work at Project Heal, and so I help kids who are in the education system. So I work a lot with the staff, the education staff, to help kids who may have different disabilities.
Okay, awesome. Well, thank you guys for coming. These are our objectives for today's presentation. There will be time for questions at the end. But first we want you guys to understand the role of an occupational therapist working with kids. That's what we do, so we'll kind of describe what we do here at CARD. We want to define childhood occupation. Occupation is kind of a term that people don't always understand, so we kind of want to describe to you what that means. And specifically we're going to look at activities of daily living as well as play. We want to help you be able to identify barriers that impact a child's success with self-care and with their play skills, as well as identifying motivators to enhance a child's participation in those activities. And we want you to walk away with some strategies to enhance a child's ability to successfully engage in their occupations.
First off, to understand the role of an occupational therapist. So in this population with working with children, an occupational therapist role is to help the child functionally engage in the meaningful and purposeful activities. Now this means for a child, you want the child to have developmentally appropriate everyday life activities. So for a child, their occupation is play and self-care, like grooming and dressing, sleeping and bathing and toileting. And then the other occupation for a child is what they're doing with their families and what they're doing in the community. For instance, what sports are they involved in? What are they doing with their church? What are they doing with a club or at the daycare or at the school, after school activities? And so this is the child's occupation.
So the next thing we want to begin with is first have everyone turn over their PowerPoints, if you don't mind. Just turn them upside down so you can't see. They're really good. You've already read ahead, beat into it, but we want to start talking about what are some of the possible barriers or what are some of the possible skill deficits that may impact your child's ability to participate in your occupations. Again, occupations are play, self-care, school, community, home-based activities. So just think aloud. I want you to kind of verbalize it out loud for us as a group. We're going to kind of just brainstorm. What do we think are some of the possible barriers? Do you have any thoughts?
I think the ignorance of other people sometimes and staff that the children are working with in the outside community.
Okay, so a barrier could be, if maybe someone doesn't understand the child, they might not give them the opportunity to try that skill or that activity. Okay, that's a good one.
A lack of attention on the child's part.
Excellent, so attention span. Barrier.
Sensory issues?
Yes. And we're going to talk more about these in just a minute, so feel free to continue learning things out, and then we'll kind of go into more detail about them.
Their motor skills.
Lack of communication.
I'm sorry, lack of
Lack of communication. My child's nonverbal, so.
Okay, very nice. So some of the things that we're going to walk through and talk about this morning, these are things that occupational therapists would work with on a child to help them be more successful in their occupations. The first one someone called out was motor skills. So specifically looking into fine motor skill development. So how is a child using their hands? Do they have the concept of maybe an emerging hand dominance, so using one hand more consistently for those things that we need skill and precision with? Do they have an understanding of using two hands together? A lot of tasks we have require use of two hands. That's referred to as bilateral integration. What are the quality of their grasp and their pinch patterns? Can they, hold and pinch things that fine require their pinch or grasp? Can they adjust their grasp on different tools to change the way something works, or use their wrist rotation to get it to work? So looking at their fine motor skills. Another component of that as well is their visual motor skills. How are their eyes and hands coordinated? Are they visually attending to their task? Are they paying attention and understanding all of the components of this task? The next one is the gross motor system. So how are things surrounding their gross motor system impacting participation? If we're doing a task that requires the child to run or walk or jump and they can't do that, that's always going to impact or be a barrier to their participation. If the activity we're asking them to do requires balance and stability and postural endurance, and this child demonstrates kind of poor postural support or poor strength, they're going to have a difficult time having enough endurance to participate in that particular activity. Motor planning is another component. So motor planning is the ability to have the idea, then be able to carry through that idea to fruition, and then the ability to kind of either adapt, kind of self-evaluate. Was that successful? Should I modify it? Should I try again? So if a child's lacking the process in any one of those areas of steps, that can be a barrier to their ability to successfully complete an activity of daily living. Sensory issues as well, so looking into whether sensory seeking behaviors are impacting my ability to participate. If I'm overly sensory seeking, am I not being able to sit down and focus long enough because I'm so sensory seeking? Am I having a low registration? So I'm not even really registering the sensory experience, so therefore things are kind of just slipping through my hands. I'm not even paying attention to whether I'm holding them, so thereby I'm not going to be able to complete that task. As well as sensory aversions or sensory avoidance. So is there something noxious about this particular activity that I have an aversive reaction to, and thereby I'm not going to participate or try? Attention, of course, there's another component of being able to visually focus, sit still, kind of visually with both your visual system and your body be able to attend to a task. And then in addition, behavior. So looking at behavior from the perspective of is this task motivating to the child? Does the child want to participate? If they do, then our behavior compliance might be higher. If this is not something that's of interest to me, then I'm likely going to be less compliant and not as interested. So taking a look also at the behavior components surrounding motivation for this child.
Okay. So when we first start working with our patients, we really want to look at environmental factors. One of the first environmental factors we'll look at is the setting. So the location of either the treatment session or the activity that they need to do at home. Is it at the house? Is it at the preschool? Where are we seeing problems? Are we seeing problems across all settings? Or are we seeing them just in one setting? And then within that setting, is there furniture? Is it over-cluttered? Is it distracting? Is there visual distractions? So is it really bright, or is there not enough light? Or what are the child's sensory needs? Do we need to adapt those things? And then temperature. Temperature was something we talked about when we were coming up with this, when we were creating this this PowerPoint presentation. It was freezing cold in the room, and one of us had a hard time concentrating because we were so cold. And so, that's another thing we really need to consider. Are they a lot of our kids will are more prone to overheating, getting hot, and so is that bothering them and making them less able to attend? We also want to look at organizational strategies to help support children, so looking at visual supports that are helpful, routines, checklists, giving them a visual demonstration or a model of what you want them to do, and then also verbal cues. Do we want to give more verbal cues, or sometimes do we need to back off and give less verbal cues? Often I would find in a classroom setting, there's so many people eager to help, and there's so many adults in the room that if everyone's giving a verbal cue at once, it's too much, and the child can't process it. So we have to think about that as well. And then we're also going to consider sensory information, which also ties closely into setting. The sights, the smells, the sounds, touching different objects. Do they have sensitivities to touch? Is there a movement component? Do they need to move a lot? Do we need to give movement breaks? Pressure, do they benefit from added pressure to help them focus? Are they sensitive to that pressure? If we're working on feeding, how does something taste? Is it a noxious smell or a noxious taste, or is it something they prefer? One of the things about the sights, vision, so a lot of times, if we go into a preschool setting, we'll walk into this great preschool room that looks very child-friendly, has lots of colors, lots of pictures hanging up, the teachers proudly displaying the artwork, as they should. But for some children who are overstimulated by a lot of visual input, they might not be able to focus on the one thing the teacher wants them to look at. Or if their bedroom is really, really messy, or the playroom is really, really messy, and we're working on a play activity, then they might need to have things cleared away and sort of a boundary provided for them so that they can visually focus. So whether it's a blanket that you lay on, or often in our OT treatment sessions we have mats that we sit on. Those can provide visual boundaries. So really looking at that distinction. And then the other thing I wanted to mention, and the fan just shut off, but as Teresa was talking, the fan turned on. And a lot of children that we work with here have a lot of sensitivities to sound, and a fan will come on, or a siren might go by, but it might be really far away, and we're able to really filter that sound out and focus on what we need to. And if you can't filter that sound might be really, really distracting. And so we need to set up that environment so it's a safe environment for that child to learn. And then hopefully generalize those skills into a more child-friendly setting once they have the skills that they're working on. Okay, and then I'm going to go into one of our first areas of occupation at this point, and decided to do a case study. We all set these up as little case studies, and then we can follow up with questions at the end of our presentation. So this little guy was 3 years old and does not successfully spoon feed. And that was the goal the parent had. They wanted them to use a spoon independently. So first we wanted to identify the barriers. We also want to identify the strengths. So the barriers for this child were that they had delayed fine motor skills. They weren't able to grasp objects with as much control as we wanted to, although he could grasp. Postural strength, he had poor postural strength, so sitting unsupported for a long time is hard and made him tired, and then made whatever activity he was trying to work on difficult. Oral sensory sensitivities, so definitely had some aversions to different textures of food. And attention at mealtime. Obviously, this is not a preferred activity, your attention is going to be limited. And this wasn't, because it wasn't preferred, there wasn't a lot of motivators. There wasn't a lot of intrinsic motivation to comply with eating independently, especially non-preferred foods. So the motivators for this child were using a preferred food to start. For this child, we did end up bringing a toy if it's necessary. I don't always recommend bringing things that will distract a child to mealtime. But for this kid, we were able to do a little play with the toy. We could turn it into a little pretend play, and it motivated him to be at the table. And so for this child, this worked. We laminated a placemat with a preferred cartoon character so that he had another visual, another thing that motivated him. It was a favorite Elmo character, and that was also, a visual motivator for him. So then we used a lot of different modifications. And Megan has a couple of things I brought. So one of the modifications when we're looking at spoon feeding is trialing different types of spoons. And there are, when we talk about the bowl of the spoon, we're just talking about the part of the spoon that you're going to bite off of. So this is going to be trial and error. There's no one set way for, one spoon that's best for all kids. It depends on their oral motor skills, if they can close their lips on things. But we find that often spoons for kids that have handles, and some of them are even more built up like this, that look like a great idea for grasping, have a very deep bowl. And so it's harder to close your lips around them. So this is actually a spoon that you would scoop like a dip out of. It's not one you would normally eat out of, but it shows you a little bit more, it's a little bit more deep, so you can kind of see what I'm talking about. And some of the toddler spoons will look like this. So for the child that I worked with, we needed to have a flat spoon that worked it was much more successful. It's easier to give them more support of the lips and the mouth, and then get the food off the spoon. We can also build up the spoon, so if they need something bigger to grasp, we can add stuff to the spoon so that they can grasp it a little bit better. And then we started with some hand-over-hand assistance to start. We also used a preferred food. And so for this child, he really liked flavored oatmeal, and he really liked brownies and goldfish. So these are things that are less likely to fall off the spoon. He was not a big fan of pudding or applesauce that were a lot slimier. So what we did with pudding eventually is we thickened it with some rice cereal just to make it a little thicker, less likely to fall off the spoon. But we really started with foods that you probably don't always have to use a spoon with, but were more motivating for him. He was really excited to eat the brownie, and so he was ready to bring that spoon to his mouth and just needed a little guidance. The guidance that I gave, we started out with some hand-over-hand assistance, and then slowly we were able to back off, because the more motivated he was, the better attention he had, the easier it was to bring that food to his mouth. Another modification we used for him, at home the mom used a booster seat, so not a high chair, but the booster seat gave him a little more support. And then in therapy we used the cube chair, which I don't have with me today, but you can turn it either way, so it can have less support or it can have more support if they're sitting at the lower end of it. And that way he could lean on that, didn't have to work so hard to keep his body upright. He still wanted to have good posture for feeding, but he didn't have to work so hard to maintain that posture. And then and I can pass these around if you want to look at them. These were just examples I had in my kitchen to kind of show you the different things that we use. The booster seat, where was I lost my train of thought there. We also use a child-sized table. So we used a little table in therapy that he could just pull the chair up to. So he wasn't at a larger table with a lot of people and was overwhelmed. That's ultimately our goal, is to have them successfully feed with the family. But to start to focus on this one thing, we wanted to eliminate those other distractions. And then as he was becoming much more successful in this with preferred foods, we started to introduce non-preferred textures and non-preferred foods. We did not do it during mealtime, we just did it during playtime, so that they could touch it, they could play with it, they could accept it being in front of them, and then eventually his mom was able to sort of bridge that a little bit to get him to taste it, and then if he didn't like it, he didn't have to eat it, but he was able to bring it to his mouth and just touch it to his lips. So we kind of had to go with the child and not push him too much, so he stayed with us. But eventually this mom was really able to be successful. He was able to sit at a child-sized table in a supported seat. And with very minimal hands-on assistance, he was able to use the spoon successfully. One of the other things, this is what I actually got distracted by, is we sometimes if kids are having a hard time holding the bowl and using the spoon, we might want to give them something so the bowl doesn't slide around. Teresa was talking about bilateral motor coordination, so we want them to be able to hold the bowl and scoop. But for some children it can be a little bit easier if the bowl's not moving around to practice that. So we can either use just your regular non-stick shelf liner you can get at the dollar store. And then OTs have what's called Dyson, which is a little bit stickier, a little bit thicker, and can help from having things slide around the table. So I can just pass this around so you guys can take a look at it. But you can get this at the dollar store. It's very easy and it works pretty well. And that's it. He ended up meeting his goal, and Mom was able to carry over a lot at home, and that was also very helpful. So now we're going to talk about dressing.
So I get to talk with you about dressing, and I wanted to specifically speak to you about a 6-year-old boy.
he is not able to do fasteners. Let's see. You want to look for the barriers that the child may have with the dressing skills. How do they use their hands for fine motor? Do they have a pincer grasp or 3 fingers, or are they still using all their fingers to grasp things? If they're younger, they might have a raking type of a grasp. So we want to look for a power grasp. Are they able to bring their fingertips together before trying to do smaller little things like buttoning? So at age 6, we would hope that they can do this. You want to look at bilateral coordination skills. And what that means is, how are they using both hands together as a team, where one hand can be holding the fabric and the other hand can be pinching the button. So together as a team in a timely, coordinated manner. Also looking at motor sequencing. So with certain dressing activities, you have a few steps involved in that task. Can they sequence those motor activities? So for motivators, so for my 6-year-old boy, loves Transformers, depending on what he was wearing. If he had a Bumblebee shirt on, he was a good guy, and if he had, Megatron, he was the bad guy. So we're kind of looking at motivators and what works with that child. So for modifications of a buttoning activity, we want to look at trying to do this activity first on a table in front of him. We don't want to stress him out by having him put the coat on or the shirt on and do it actually on his body. I'm going to show you something here. Sometimes you can get a buttoning board. It's like Dr. Toys has like a dressing cube. You can get those dressing dolls, or you can make something yourself. This was something that Megan let me borrow. And obviously, the larger the button, the sturdier the button, that's where you want to start. You wouldn't want to start with a real tiny, slippery button. This is a nice one. It has like a little round edge to it. You can really grasp it. If you have a shirt in front of him that has like 6 buttons, in the beginning, you really only want them to do 1. So you might model the first 5 and say, okay, can you help me with the last one? And let them try just the 1. We don't want to make the task too hard. Make it easy and something that they can accomplish. Also, silly sounds can help with memorizing things, like zoop, put it in, or whatever song you want to add to it. Modify the words to a song that they like, and make it more interesting. And then you can add things like that would help with the memorizing the sequencing, like pinch, push, pull, pinch, push, pull, or whatever you want to come up with. So you're giving a visual and the auditory for the sequencing. You can also have the picture cues, the visual sequencing. And so for this 6-year-old child, that's what really did help. So there was a picture of what to do first, second, and third, each step of the way. So when we look at the outcome, standing in front of a mirror was helpful because you got to see what he was doing when we actually worked on doing it on his body. And we did the pinch, push, pull, so that was helpful. And he had a visual chart so he could see each step as it went through. And that's what worked. And then we phased out of that eventually. But that was how he was able to get himself dressed in the morning. All right. Areas of play.
So the case I'm going to talk about to you is a little boy. He was a little over 2.5. He was between 2.5 and 3. And the area that his mom was concerned with was the repetitive interest in balls and a limited kind of functional use or functional display of play skills that he had. So these were some of the concerns that we worked on. Some of the barriers, obviously, were his child's attention. He was hyper-focused on tossing balls and had significant less attention or focus to any other play activity. So motivation, obviously motivated for the preferred activity, not motivated for the non-preferred activities. Some sensory components I felt like came into play with this little boy. For example, anytime he threw the ball, he would purposefully run over to the portion of the room where we have a tile floor and throw it on the floor. So to me, he was seeking some auditory input from this play activity. He wasn't throwing it just on the carpet or just throwing it wherever. He was purposely had a plan of bringing it and listening to them fall on the floor. So he had some sensory components that were coming into it. He also was a pretty hard thrower, like throwing with pretty much force, not just dropping. So that can also be possibly some pressure-seeking experiences that he's getting from this activity. Motor planning was also, a component in that he had the idea of, I want to get that ball, I want to throw it here at this floor, but then it didn't go beyond. So there wasn't an additional kind of reevaluation of, okay, I've done this 5 times, is there anything else I can do with this? So he was kind of stuck in this one motor planning phase, not able to move on. So one of the things that I was working with the mother on was really to play with your child. You need to meet your child where they are. So if tossing balls repetitively on the floor is your child's preferred activity, that's what we're going to start off doing. Because if I take you over the table and say, let's sit down and string beads right now, what do you think is going to happen? Not interested, tantrum, refusing, will probably never play with me again. So the first thing I'm going to do is, this child is repetitively throwing balls on the floor, so I'm going to do the same exact thing that he's doing to say, that's fine, I accept that that's the way you're playing, that's what I'm going to do. So we're throwing balls, we're hearing the auditory sound. So you can tell where auditory feedback comes from when you hear the balls bounce on the ground. And after I do that so many times, kind of copying what this child is doing, I'm going to try to change the activity a little bit. So part of encouraging play in your child is going to cause you to be creative and have to think like one step ahead of your child. So the next thing I'm going to do is just add in a different action into this activity. So I'm going to bang, 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 and using the verbal cue to say what I'm doing so that they're also learning a new action. And I'm going to drop them on the floor. Bang, 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 bang. Then I might hand them, you try it, your turn. Just offer it to them and see if they're willing to do it. Might not be willing to do it. I'm going to keep modeling and demonstrating. Obviously, this can take several times or several attempts, so I'm just going to talk to you about the sequence that we worked through to get this child to do it. So after, say, I bang, 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 and I toss on the floor, and they're copying me, so they're imitating. Bang, 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 tossing on the floor. Okay, so now I've added a step. Instead of just running over and throwing them on the floor, we're banging and then we're throwing them on the floor. So now I'm going to add in a precision component into it. So instead of just dropping them on the floor, is there something purposefully we can put them into? So trucks and cars were very motivating for this little guy, so I'm going to get my dump truck, and this time I'm going to bang, 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 put in, and try to direct into more purposeful. It still makes noise. You can hear it, right? So I still have that auditory component that I'm providing for them. So I'm going to keep on doing this to see if they're going to imitate and copy. I'm trying to increase their repertoire of play, start to make it a little bit more purposeful. After we do that, we can bang, 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 we put in, then we can start using this truck as purposeful. So now I'm trying to move us away from just a ball and add in another toy, appropriate for a little kid to be pushing around a truck. So we're going to vroom, vroom, vroom. Let's take the balls and pour out. And then we can take the truck back to the balls and bang, 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 put in. Let's drive the truck, vroom, 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 pour out. So I'm going to try my best to be creative with what their initial interest is and slowly add step by step by step. And like I said, it's not going to be that the first time I bang these balls, the child's going to be like, oh, now I know what else I can do with those balls. Let me copy you. It's going to take a lot of repetition. It could be also that I stop banging the balls and I just start dropping them in a basket. Instead, I kind of stop that for a minute. He wasn't catching on. He wasn't doing that. I have to think creatively, what else can I do with these balls? All right, let's just try throwing for a big basket. Once I filled the basket, maybe he hasn't even helped me, then I'm silly and I dump them out all over my head and do something funny like that. So just trying to work with the child's interest, because that's going to be their motivator. If there's anything else you can incorporate in, like this child really liked cars and trucks, you would try to bring that in and pair it together so you can start pairing two preferred activities together. And obviously our outcome is that the child's going to imitate you, demonstrate increased repertoire when you're with them, so they're modeling and they're trying, but then they will actually initiate it on their own at a different time. So, as each session progressed, if this child came and picked balls and he started throwing them immediately on the floor, he would look around for the truck, like where is it? He knew that that was now in his repertoire of play to bring out and to add that component in to dropping. I think he limited out the banging part, but he started purposely throwing them into the truck to then drive them and deliver them. So we want to see that by this introduction that they are then able to increase their repertoire of play.
Is it okay to ask questions now, or should we wait till the end?
Do you mind if we just wait until the end? That way we're sure. Just make a note next to your thing. We'll definitely address your questions when we're done. Thank you.
So I'm going to talk to you guys a little bit about grooming today. And I picked a little boy that I'm currently working with. We've been working together for probably over 9 months on this specific goal that I'm going to tell you about. He's 10 now, and he demonstrates a lot of negative behaviors and poor tolerance for having his hair cut. And I think that's like a common thing that I hear when kids come in for evaluations. I ask their parents, how does your kid do with haircuts? It's terrible. I do it at night when he's sleeping. Or I buzz it all off so I can let it grow long and I only have to do it 4 times a year. So I feel like it's something that at least the kids that we work with have a big problem with. So this little guy had some serious negative behaviors. He couldn't go to the barber to have his hair cut anymore, despite mom trying. I think another patron at the barbershop had actually called protective services because this kid was having such negative behavior. So she was having to do it at home now. And it took her over 3 hours to get the hair cut. He kept having tantrum behaviors. So some barriers were obviously his negative behaviors. He's a big guy. I mean, he's 10 now, and he's almost my size. So it was the concern of hers, how am I going to do this as he's getting bigger and showing even more aggressive behaviors. He has poor self-regulation skills. So when he goes into the barbershop, he can't talk himself down, he can't take a break, he can't tell anyone how he's feeling, he just exploded. He has tactile sensitivity, so he doesn't like the way that feels on his head. He doesn't like people touching him and holding him still. And then another added component that I think was happening for this kiddo is this is part of his routine, his habits. It's ingrained at this point. He's 10 years old, and he's been having kind of this cycle of behavior for some years now. Some motivators for this child were preferred food items. I don't love to do that. I don't like to say, if you do this, I've got a lollipop at the end. That was motivating. That's what his mom was doing. He likes electronic games and toys, so he would play on the computer. He likes almost anything on the computer, really, but I guess the handheld video games and stuff. He's into that. After working with me, he started to be motivated by what I would just call earning time. So after some significant behaviors in our sessions, we sort of set up a strategy. He gets like 3 opportunities, like if it's kind of like a 3 strikes, you're out, but not really. So as long as he doesn't earn 3 X's for negative behaviors, he gets to choose an activity for earning time. If he gets 3 X's, it's cool, but then Miss Megan picks the earning time, okay? So that became motivating to him. And as we went along, he was then motivated by others expressing pride in him, which was awesome because he didn't really care about that before. Was desensitization strategies. So we did a lot of deep pressure, a lot of vibration outside of the buzzers. The only time he was really experiencing that kind of sensation was at the haircut. So we worked on it during play. We worked on him doing it. He's used to somebody coming at him with buzzers. Now I just put something that has that same sensation in his own hand. I let him do it to me. He's used to people doing it to him, so he would do it to me. He would do it to himself, to his mom. So we worked on light touch. We worked on different fabrics, different parts of his body, allowing him again to have control of haircut clippers. So his mom brought haircut clippers that she was using at home, the very same ones, and I didn't have arm hair one week. Like, I just let him try it, like, just so he had a sense of control. He created a social story with me, again, because he loves the computer. We, again, were working on self-regulation, so I had introduced different terms to him, giving him language to say when he's not feeling comfortable. We used a lot of visuals. I don't know if you guys are familiar with the ALERT program, but it talks about if your engine's feeling high, if your engine's feeling just right, or if your engine's feeling low. So Justice's engine was feeling really high every time he got his hair cut, and it was okay. First step is tell me that you're feeling that way. So I'm trying to replace those negative behaviors with communication. So we worked on that, and he ended up making a social story that then he was able to use every time he got his hair cut. We worked and created some visual supports together. I let Justice help me. I'm sorry, little boy you're gonna meet, his name's Justice. So he made some visual supports to encourage his communication. Because just because I taught him the word doesn't mean he's gonna pull it right out of his head. So first I wanted him to point to it, to communicate. And then I provided a behavioral incentive and immediate feedback about his behavior. So I don't wait till the end of my time working with him at the end of an hour to say, hey, remember like 6 minutes after you walked in my room and you threw something at the door, that was an X. I'm gonna tell him right then, and I'm gonna tell him what I need him to do. So those were a lot of the modifications. Again, I've been lucky enough to work with this kiddo for quite a while, and I want you to remember that as you watch the videos that I have. So his outcomes, I'm gonna let his mom tell you about those on the video. But right now she's able to do his haircut at home, just him and her, in under 20 minutes. He's demonstrating positive behavior during this time. He's requesting breaks to be calm. And this all sounds really good, but this isn't a best case scenario for him. His negative behaviors are still there. It's still hard for him to use his words. I think across the board, like as all of us have been talking to you about all these different activities, we want to create it the easiest environment when these kids are learning a new skill. You want to take all the other stuff away. If I'm working on you getting your hair cut, that's all I want you to focus on. I don't want you to worry about everything else. I want to make it as safe as possible. All the other things that are hard for you, the barriers that we were talking about, I'm going to try to eliminate them as much as possible during that activity. Okay? So it takes time, and it's not foolproof. I did ask Justice and his mom if we could videotape some of this process, and they agreed. His mom was really excited to show this because she's very proud of him. But it's not easy, and I want you to see that part too.
So I think, one of the things that that video, you really feel for the mom and for the kid, and you almost like I could feel my own body. I've watched this several times. I've seen this child, and even I'm holding myself tense, and because I know he's uncomfortable, and I can feel my own body kind of moving around. And so I think we really have to, when we're looking at all these different outcomes and all these different skills, look at the child's strengths, really build on those strengths, and then identify their weaknesses, identify the things they're struggling with. And use those strengths and use those things that drive your child to help motivate them. It's easy for us to write this on paper, but as you can see in the video, it's so much harder in practice. It takes a long time, it takes a lot of dedication, it takes the families spending a lot of time at home doing this, which is not easy, especially if you have other kids and you've got soccer practices to go to and you've got to get all over the place and take them to school. So, one of the things we really want to look at when we're developing goals with our families is what are all of these, what is going on, and how can we help make this a simple task? How can we kind of get rid of all the other things that are impacting the child so they can just focus on learning that task and sort of just automatically go in and filter out everything for them so they don't have to work so hard to do that. And then obviously once they learn that skill, once they're getting more strong at that skill, once they feel more confident, then we can start challenging them by generalizing that. So it might be a long time before Justice could get his hair cut at the barber shop, but ultimately, as an adult, that's the goal we want for him. We want to be able to get his haircut when he needs to. But it's just going to take a lot of patience and a lot of time.
So definitely, you know, looking at the barriers, looking at the motivators, how do we modify it for them? And then the outcome, really creating achievable goals for your child. So the achievable goal might not be next week they're going to be feeding independently or dressing independently, but they might accept the activity. They might let you help them with it. They might, you know, make achievable goals and then really celebrate the progress. Even if it's a very tiny little step of progress, it's still progress and it's still exciting and it's still that prerequisite they need to meet that ultimate goal that you have for them. And I think also just understanding the amount of time that will go into some of the skill attainment. Sometimes it just takes a long time. But, you know, working with your therapist, working with your teacher, really giving them feedback, this is working and this is not working, so that we can then adjust and come up with other ways to help you. So if one thing we've suggested is not working at all, we definitely want to modify that strategy ourselves and help you guys come up with new strategies. And I think it's time for questions. So who has questions?
Lindsay, you had more
Question by
I did.
Michelle?
But my son is 10, and we've been with Kennedy since he was 2. There's I don't know, are you familiar with cranial sacral therapy? Yes, and Diane Nemeth is